For too long, women's pain has been ignored. We sat down with 3 Monash experts to ask why and what's changing. Alyssa Fleming teaches the next generation of midwives. Malcolm Starkey directs the Bladder and Kidney Health Discovery Program. And Rochelle Bookbinder leads the Musculoskeletal Health Unit. This is what they had to say. Women's health issues have been long under-recognised.
Yep.
What do you think has driven that?
I think a lot of male bodies were used as the norm to do research on, to gain knowledge from, and women were pretty much dismissed when it came to understanding the knowledge behind what is normal in the healthcare system.
These topics can be quite taboo. So for example, if you take something like urinary tract infection, because it's a problem of downstairs, because it's a problem that affects women, 1 in 10 men might get a urinary tract infection in their lifetime, but 1 in 2 women will get a urinary tract infection in their lifetime.
Musculoskeletal pain is hard to see. It's not like a skin cancer that you can see, or someone who doesn't have a leg, or someone with heart disease. It's not something that's very visible, and I think that goes for all sorts of painful conditions.
Problems around diagnostics as women experience with UTIs, and they're often gaslit or not believed by the medical community and thought to be it's a psychological thing. So imagine having the pain of a urinary tract infection where it feels like it's on fire every time you need to wee, every day for years. And so these women describe to us that the pain they're experiencing is excruciating. So, 8 out of 10 is the average pain threshold that these women are describing to us. In a survey that was done here in Australia, without being prompted, when they were just asked to give any additional information, the women that suffer from these chronic UTIs, 1 in 10 voluntarily gave the information that they had either attempted or thought about suicide. And so there's a disconnect between the experience that women are experiencing with the pain associated with these urinary tract infections compared to what the diagnostics are saying, which are missing up to 50% of the infections.
They also seem to be more disabled than men for the same conditions. And perhaps they don't always get the best care compared to men. So, for example, we know that joint replacements occur more commonly in men, but osteoarthritis occurs more commonly in women, so there should be more joint replacements among women. And in this day and age, everything that we do to patients, we should have good evidence that it works and evidence that the benefits outweigh the harms. And if we don't have that, we should explain to patients that we don't know. And increasingly, we know that doing nothing is actually better for many things than doing something. 30% of what we do is of low value, which means that it won't benefit patients, and another 10% is actually harmful. So that's 40% of healthcare. If we could get rid of that, we would improve the health of patients, we would save a lot of money, we would reduce the carbon footprint of healthcare. So that's 40% of what we do.
How is Monash positioned to change this?
So women should feel comfortable and emotionally safe throughout their whole pregnancy journey to be able to discuss pain with their care provider. Continuity of care is something that we are working on and something that we should be promoting. So women having that same care provider throughout their whole pregnancy and postpartum journey build that rapport and trust to work in partnership with each other.
We really need to prioritise the impact on people's quality of life. And so when people are reporting 8 out of 10 pain thresholds on a daily basis, when their careers and their families, their livelihoods, their marriages are being destroyed, I can't think of any bigger impact on us as people. And so we really need to think as we move forward with our approaches in science and medicine that we don't just think about the statistics, but we think about the people. I think Monash is really in the ideal position. And so what we've done is we've set up what we call a bladder and kidney health discovery program. And the purpose of this program is to really bring together a multidisciplinary team, because really we can't achieve positive changes for things such as urinary tract infection unless we work together as teams. And so we've brought together clinicians from infectious disease, renal medicine, urology, as well as basic scientists in microbiology, immunologists such as myself, as well as people in sexual health, for example, bringing together this diverse expertise that we have across the whole Monash portfolio and the associated hospitals to really bring a multidisciplinary approach to how we tackle such a complex problem.